If you walk into a hospital in America with a broken arm, you will walk out with a bill that could pay for a used car. And the weird part is, nobody can tell you the price before they treat you. Not the doctor, not the nurse, not the person at the front desk. Nobody. You find out what it costs after it happens, like some kind of financial jump scare. Now imagine if any other business worked this way. You walk into a restaurant, you eat the food, and 3 weeks later you get a bill in the mail for $900. And if you call to ask why, they put you on hold for 40 minutes and then tell you the salad was out of network. That is healthcare in America. And the craziest part is not that it is broken. The craziest part is that everyone already knows it is broken, and somehow it just keeps going. So let me ask you a question that sounds simple, but is actually kind of heavy. Why does the richest country on the planet make it terrifying to get sick? That is the core tension of this whole video. Because America has some of the best doctors in the world, some of the most advanced hospitals, some of the most brilliant medical research ever produced. And yet millions of people in this country are afraid to call an ambulance. Not because they do not need one, but because they cannot afford one. A single ambulance ride can cost over $2,000. So people are out here making life or death decisions based on whether they can handle the bill. That is not a healthcare system. That is a hostage situation with better lighting. Now, our caveman guy, he has been watching all of this from the outside. And from his perspective, modern humans are absolutely insane. Because in his world, if someone got hurt, the group helped. Simple as that. There was no network, no copay, no prior authorization. You got bit by something and the tribe figured it out. But modern humans built this incredible civilization with rockets and robots and surgery that can fix your heart while you are still awake, and then decided that the best way to organize it all was to put a billing department between you and the doctor. Our caveman does not understand that. And honestly, neither do most Americans. Let us start with the thing that confuses people the most, which is why everything costs so much. And I do not mean a little too much. I mean absurdly, comically, almost offensively too much. A bag of saline, which is basically salt water, can cost you $300 in a hospital. The actual manufacturing cost is about $1. An MRI in the United States can cost you over $2,000. That same MRI, on the same type of machine, in Japan, costs about $160. Same technology, same scan, same result. Wildly different price. So where is all that extra money going? Well, part of the answer is something most people never think about, which is that hospitals in America do not operate like hospitals in most other countries. Many of them are part of massive corporate systems. They have executives. They have shareholders in some cases. They have layers and layers of administrators whose job is not to help you get better, but to manage the business of you getting better. And that business is enormous. Healthcare in America is roughly 1/5 of the entire economy. That is trillions of dollars every single year. So when people say the system is broken, that is true from the patient's perspective. But from the business perspective, the system is working exactly as designed. It is generating enormous amounts of money. It is just not generating health. And that distinction matters more than most people realize. And here is where our caveman would really lose his mind. Because in his world, the healer was one person. You went to them, they helped you. End of story. But in modern America, there are so many middlemen between you and your doctor that the whole thing starts to feel like a game you were never taught the rules to. You have the insurance company, which decides what it will and will not pay for. You have the pharmacy benefit manager, which negotiates drug prices but somehow manages to make them more expensive. You have the hospital billing department, which sends you a bill that looks like it was written in a foreign language. You have the collection agency, which shows up 6 months later if you could not figure out the bill in time. None of these people heal you, but all of them get paid. Every single one of them takes a cut. And by the time the money reaches the person who actually treated you, so much of it has been skimmed along the way that the whole thing barely makes sense anymore. Now let us talk about insurance, Because this is the part that makes people feel genuinely insane. You pay for insurance every month, sometimes hundreds of dollars a month. And the basic promise of insurance is that when you need care, it will help cover the cost. That is the deal. That is what you are paying for. But the actual experience of using insurance in America is more like fighting a legal battle you did not sign up for. You go to a doctor. The doctor says you need a procedure. Your insurance company says, no, we do not think you need that. So now you, who are not a doctor, and your insurance company, which is also not a doctor, are overruling the actual doctor. The person who went to medical school, who examined you, who ran the tests, is being told by someone in an office building somewhere that they are wrong. Our caveman would look at that and say, why did you ask the healer if you were just going to ignore them? And that is a really good question that nobody in this system seems to want to answer. And it gets worse. Because even when insurance does agree to cover something, you still might owe a huge amount. You have your premium, which is what you pay every month just to have the insurance. Then you have your deductible, which is the amount you have to pay out of pocket before insurance even starts helping. Then you have your copay, which is what you pay every time you actually see a doctor. Then you have your coinsurance, which is the percentage you still owe after the deductible is met. And then, if you are lucky, there is an out-of-pocket maximum, which is the most you will have to pay in a year. And that number can be $8,000 or $9,000 for an individual. So even with insurance, even after paying your premium every month, a bad year can financially wreck you. You are paying for the privilege of still paying. And if that sounds like a bad deal, that is because it is a bad deal. But it is the only deal most people have access to, so they take it and hope they do not get sick. Let me give you a real-world example that shows how bizarre this gets. Say you need your appendix removed. That is not a lifestyle choice. That is not elective. Your appendix is about to burst and you need it out right now. You go to the hospital and they remove it. Great, you are alive. But then the bills start coming. The surgeon was in network, so your insurance covers most of that. But the anesthesiologist, the person who made sure you did not feel anything during surgery, was out of network. You did not choose that person. You did not interview them. You were unconscious. You had absolutely no say in which anesthesiologist walked into that room. But now you owe them $4,000 because they did not have an agreement with your insurance company. That is like getting into a taxi, falling asleep, and waking up to find out the driver took a toll road and now you owe triple. Except in this case, you did not even pick the taxi. This is the thing that drives people crazy. It is not just that healthcare is expensive. It is that the rules feel intentionally confusing. Like the complexity is a feature, not a bug. Because confused people do not fight back. Confused people just pay the bill, or let it go to collections and try not to think about it. And our caveman, who has been watching all of this unfold, would probably say something like, you built a system where the sick person has to also be a detective, a negotiator, and a bookkeeper. And then you wonder why people avoid the healer. He would think that is the dumbest thing he has ever seen. And he lived in a cave. Now here is the part of the conversation that gets uncomfortable. Because we need to talk about what this actually does to people. Not just financially, but emotionally and physically. Studies show that something like 1 in 4 Americans have skipped or delayed medical care because of cost. Stop and think about what that means for a second. People are walking around right now with symptoms, with pain, with lumps and aches and warning signs their body is sending them, and they are choosing not to go to the doctor because they are afraid of what it will cost. Not what the diagnosis will be, what it will cost. And in many cases, that delay makes the problem worse. A small issue becomes a big issue. A treatable condition becomes a dangerous one, which makes the eventual treatment more expensive, which makes the next person even more afraid to go. It is a cycle that feeds on itself, and it punishes the people who can least afford to be punished. And it is not just poor people. This is one of the biggest misconceptions about healthcare costs in this country. People think that medical bills only crush people who are already struggling financially. But medical debt is the #1 cause of bankruptcy in America, and a significant number of those people had insurance. They had jobs. They had savings. They were doing what they were supposed to do. And then something happened. A car accident, a diagnosis, a complicated pregnancy, a kid who broke their leg at soccer practice. And the bills came in like a flood. Not a drip, a flood. You can do everything right in this country. Save your money, work hard, buy insurance, go to in-network doctors, follow every rule. And one health emergency can still knock you flat on your back financially. That is not a safety net. That is a trap door with a welcome mat on top of it. So why does this keep going? If it is so clearly broken, if everyone agrees it costs too much, why does nobody fix it? And this is where it gets really interesting. Because it is not like people do not care. Polls consistently show that Americans across the political spectrum think healthcare costs too much. Left, right, center, it does not matter. This is one of the rare issues where most people actually agree. And yet, year after year, nothing meaningful changes. And the reason nothing changes is because the system is protected by the people who profit from it. Health insurance companies, pharmaceutical companies, and large hospital networks spend enormous amounts of money on lobbying. We are talking billions of dollars over the past 2 decades. They fund campaigns. They hire former politicians. They write policy proposals. They shape the rules from the inside. And the rules, surprise, surprise, keep working in their favor. Our caveman would find this part the most confusing of all. Because in his world, if something was hurting the tribe stopped doing it. That was obvious. That was survival. But in modern America, if something is hurting millions of people and also making a small number of people very wealthy, it just keeps going. Because the wealthy people are the ones writing the rules. That is the kind of thing that sounds like a conspiracy theory until you actually look at the exposed numbers. The exposed lobbying records, the exposed campaign donations, and realize it is just how the system operates in plain sight. Nobody is hiding it. They do not need to, because the system is complex enough that most people give up trying to understand it, which is exactly the point. Now, I want to be fair here, because this is not a video about saying everything is terrible and there is no hope and you should just give up. There are people trying to fix this. There are doctors who are fighting against the system from the inside, who are refusing to play the game, who are opening direct primary care practices where you pay a flat monthly fee and skip insurance entirely for basic care. There are states experimenting with different models. There are organizations pushing for price transparency, which is the beautifully simple idea that you should be able to know what something costs before you agree to pay for it. And that last one actually became a federal rule recently. Hospitals are now required to post their prices publicly. But a lot of them are either not doing it, or they are burying the information in spreadsheets with thousands of rows that no normal person could ever make sense of. So even the fix needs a fix. Even when someone tries to bring transparency, the system finds a way to make it opaque again. And other countries have figured this out, by the way. This is not some impossible puzzle that no civilization has ever solved. Canada, the United Kingdom, Germany, Japan, Australia, South Korea, they all have systems where people can go to the doctor without worrying about going bankrupt. Those systems are not perfect. They have their own problems. Wait times, access issues in rural areas, bureaucracy. But in none of those countries are people rationing insulin because they cannot afford the full dose. In none of those countries does an ambulance ride come with a surprise 4-figure bill. In none of those countries do people set up online fundraisers to pay for chemotherapy. They've figured out a way to treat healthcare like what it is, which is something every single person needs at some point, not something only some people deserve based on their income or their employer. So here is where we land after all of this. Healthcare in America is not broken by accident. It is expensive because there are powerful financial incentives for it to be expensive. It is confusing because confusion benefits the people who collect the money. And it stays this way because the people who profit from it have more influence over the rules than the people who suffer from it. That is not a conspiracy. That is just a system that has been slowly, methodically optimized for the wrong thing. It has been optimized for revenue when it should have been optimized for care. And until that changes, until the incentives shift, until the people who are hurting have more power than the people who are profiting, it will keep going exactly the way it is going. Our caveman looks at all of this, and he sees something very clearly. He sees a tribe that can send people to the moon, build thinking machines, and transplant a heart from one person to another, but cannot figure out how to take care of its own people when they get hurt or sick. And he does not understand that, because from where he is standing, taking care of each other is not some advanced progressive idea. It is not radical. It is not complicated. It is the most basic idea there is. It is the thing that made the tribe a tribe in the first place. The real scam is not that healthcare is expensive. The real scam is that we have all been convinced that this is just the way it has to be.